Basic life support. CPR for adults. There is a common acronym in BLS used to guide providers in appropriate steps to assess and treat patient in respiratory and cardiac distress. This is CABD. Circulation, airway, breathing, defibrillate. The following scenario will help guide you to performing CABD. You find an adult lying on the ground. First step, to assess, to make sure the scene is safe for you to respond to the down patient. Next is assess for the responsiveness. Stimulate and speak to the adult asking if they are okay. Look at the chest and torso for movement and normal breathing. If that person is unresponsive, there may be two chances. One is of one provider. You may be alone, or there is somebody to help. For consider two providers. So the first one, with one provider, first call the emergency response team and bring an AED to the patient. Second, with two providers, have someone near call the emergency response team and bring the AED. Place patient supine on a hard flat surface and check for the circulation. Check the patient for a carotid pulse for 5 to 10 seconds. Do not check for more than 10 seconds. And if the patient has a pulse, move to the airway and rescue breathing portion of the algorithm. Provide 10 rescue breaths per minute, that is 1 breath every 6 seconds. Recheck pulse every 2 minutes. And if patient doesn't have a pulse, begin 5 cycles of CPR. Last approximately 2 minutes. Start with chest decompressions. Chest compression, provide 100 to 120 compressions per minute. This is 30 compressions every 15 to 18 seconds. Place your palm midline, one over the other, on the lower 1/3 of the patient's sternum between the nipples. So you can see in this picture. Lock your arms. Using two arms, press to the depth of 2 to 2.4 inches. That will be 5 to 6 centimeter or more on patient's chest. Press hard and fast. You can see in this picture. Allow for full chest recoil with each compression. One cycle of adult CPR is 30 chest compression to 2 rescue breaths. If two providers are present, switch role between compressor and rescue breather every 5 cycles. Airway. In the event of a unwitnessed collapse, drowning or trauma, use the jaw thrust maneuver. Place your finger on the lower rim of the jaw. Provide anterior pressure to advance the jaw forward. In the event of a witnessed collapse with no reason to assume a cervical spine injury, use the head tilt chin lift maneuver. Place your palm on the patient's forehead and apply pressure to tilt the head back. Use the fingers of your other hand under the mental protuberance of the chin and pull the chin forward and cephalic. So you can see in this picture, head tilt, chin lift maneuver. Breathing. Scan the patient's chest and torso for possible movements during assess unresponsiveness. Watch for abnormal breathing or gasping. If the patient is breathing adequately, continue to assess and maintain a patent airway and place the patient in the recovery position. Only use the recovery position if it's unlikely to worsen patient's injury. The patient is not breathing or is breathing inadequately. Check patient pulse. If the patient has no pulse, begin CPR. Use a barrier device if available. Pinch the patient's nose closed. Make a seal using your mouth over the mouth of patient or use a pocket mask or bag mask. Each rescue breath should last approximately 1 second. Watch for chest rise. Allow time for the air to expel from the patient. During normal CPR without an advanced airway, provide approximately 6 to 8 rescue breaths per minute. During normal CPR with an advanced airway, provide 10 rescue breaths per minute. Don't pause chest compression for breaths. If patient has a pulse and no CPR is required, provide 10 rescue breaths per minute. 1 breath every 6 seconds. Recheck pulse every 2 minutes. If there is a foreign body obstruction, perform abdominal thrust. Next is recovery position, lateral recumbent or 3/4 prone position. This position is used to maintain a patent airway in unconscious person. Place the patient close to a true lateral position with head dependent to allow fluid to drain. Assure the position is stable. Avoid pressure of the chest that could impair breathing. Position patient in such a way that it allows turning them onto their back easily. Take precautions to stabilize the neck in case of cervical spine injury. Continue to assess and maintain access of airway. Avoid the recovery position if it will sustain injury to the patient. The last step, defibrillate. Arrival of AED, automated external defibrillator. Turn on AED on now. Early defibrillation is the single most important therapy for survival of cardiac arrest and should be done as soon as it arrives. Follow verbal AED prompts. First is attachment. Firmly place appropriate pad. There will be appropriate pad for adult and pediatric. So appropriate pad should be connected to patient's skin to the indicated location. Above the pad, it is clearly shown where the pad should be located. After attachment of the pad, next is to analyze rhythm. So each step will be the prompt will be given by the AED machine itself. Second step, analyze. A short pause in CPR is required to allow AED to analyze the rhythm. This means no compression or breathing should be given in the time of analyzing. So after that, if the rhythm is not shockable, initiate 5 cycles of CPR. Recheck the rhythm at the end of 5 cycles of CPR. And if the shock is indicated, assure no one is touching the patient or is in mutual contact of good conductor of electricity by yelling, "Clear, I am clear, you are clear," prior to delivering a shock. Press the shock button when the providers are clear of the patient. Resume 5 cycles of CPR. Next is for children and infants. That will be continued in the next session. Thank you.